Hi, everyone. We are so happy to have you, whether you are joining us here today or watching later on our Cure GABA-A YouTube channel. We ask that you please mute your mics if you have not done so already, and include any questions that you might have in the chat box below. We will have time to answer questions at the end of the presentation. My name is Monica Joanna Elnacave, and I'm the CEO and founder of Cure GABA-A, a nonprofit organization with the sole focus to develop potential therapies for GABA-A variants by partnering with world-renowned researchers in GABA-A and the organization of patients for clinical trials. Today, we welcome Gerry Nesbitt. Gerry Nesbitt is an esteemed figure in healthcare and clinical IT. He will guide us through the onboarding process to obtain our CRID, C-R-I-D, which is an identifier tailored for clinical research purposes. Gerry Nesbitt has a notable history in delivering cutting-edge, web-based technology platforms for medical research. Gerry also directed informatics divisions for global projects like the Epilepsy Phenome Genome Project and the Human Epilepsy Project from 2007 and 2014. I'm handing it off to you, Gerry. Please help us understand the what, why, and how to obtain CRID.
Well, thank you, Monica, for that warm introduction. It's a pleasure to be here with you all today, and I'm truly grateful for the opportunity to share the innovative CRID solution with your community. And my goal is to help rare disease research through information technology to basically help them. And one such solution is the CRID, or the Clinical Research ID. So let me start by giving you some background as to why I created CRID and the problem it addresses. In clinical research, parents and patients expect that the data that they provide to the various clinical research projects, they expect it to be coordinated with other research studies and shared with other research studies. But the truth is that rarely happens. So it's rarely reused. It's collected and never reused again. And you often find as well that the forms there are being completed repeatedly on each research study. And the truth is that research data, that once it's collected, it's analyzed and then locked away in what's called inaccessible data silos. And if they do decide that they want to try and share data between research studies, the only way they can do that is by exposing or sharing the patient's name, address, and date of birth to link that data across research studies. And this is actually not acceptable. And that is why I created the CRID identifier. So what is CRID? CRID stands for Clinical Research ID. And its definition is it's a unique, universal, patient-generated identifier to facilitate collaborative rare disease clinical research, a bit like a social security number, just for clinical research. So this is what a CRID looks like. We collect a nickname, first name, last name, sex, date of birth, and also some optional information about your child's condition. And this is the random unique identifier that's generated. It consists of letters and numbers, and it doesn't use ones or zeros or I's or O's or L's because they can be confused. So this diagram here just illustrates how the CRID is used from the point when it's created to the various research studies. So here we have a patient or parent creates a CRID identifier on the CRID website. They are enrolled in 3 different clinical research studies, Study A, Study B, and a patient registry. And the patient shares their CRID with each of these researchers. So now each researcher's study has a database with an identifier identifying that patient's data. And at a point in the future, then they're able to merge or share these data sets here. They're no longer data silos. because they have an identifier that identifies the same patient across the three different data sources. Up to now, it has not been possible to share these data silos, but with the CRID, this is now possible. So the benefits of CRID are it allows you to reuse, merge, or share de-identified research data across research projects. It eliminates these data silos where the data is no longer used or accessible. It allows researchers to share data without exposing or sharing any private patient information, which is called PHI or PII. And the parent or patient can decide if they wish to share their CRID with the research study or not. And the CRID principles are, it's always free, it's always optional, and it's always private. This is a quotation from Tracy Dixon Salazar, who said that using a CRID empowers the patient's family to be in control of the research data, allowing them to share their data with whomever they want. This is an important step in sharing data across data silos, so the burden on the patient family can be reduced and the research can move forward faster. CRID is IRB approved, which means that it adheres to ethics standards in terms of data collection and data privacy and security. Now I'm going to jump over to give a demonstration of the CRID system and how you create an account and how you create your CRID identifier. So the CRID website is https://thecrid.org, and it'll bring you to this page here. There's information here about what CRID is, the principles, who's using it, what are the benefits, and all that information is here. So in order to create a CRID, you have to create an account first. If you already have an account, you click on login. So I'm going to create an account. Which is at least 8 characters, contains at least one uppercase letter, one lowercase letter, and a number and a special character. Or your first name, last name, and you can put in a backup email address just in case your primary email address no longer works. Okay, so I've created an account and now I'm going to log in. First thing you're asked to do is create a person. So this is the person that you want to create a CRID identifier for. You can give them a nickname. So the first few fields, they're all mandatory. So nickname, first name, last name, sex, and date of birth. Then the disease name, gene, and genetic variant. These are optional fields, which you may wish to fill them in. So you put in disease name, the gene, and a genetic variant if there is one. And then click save. And there it is, created a CRID 6 FEW, TW, or Q. So that's just random letters and numbers that are going to creating your CRID identifier. And then you can create a second one for yourself or for other family members by just clicking on the add person. And there's a limit of 5. You can create up to 5 CRID identifiers. And if you need to create more, you can contact me and I will create them. So what you will do is when you enroll in a research study and they ask for your CRID identifier, you will send them this 8-digit character string, and that is your CRID, and you will send it to them and they will input it or save it as part of your record on that clinical research study. And then when you want to log out, there's a log out button over on the right-hand side, and you can click log out. Every 3 to 5 months, we will send you a reminder email of that CRID identifier. So you'll just receive an email from us saying this is the CRID or the CRIDs that you created. At any point, if you ever want us to remove that CRID from the account, you can just contact us and we'll remove your data. If you come back a second time, so if you create a CRID and then a few weeks later you want to come back and log in, you can just click log in, put in your username, password, and you're just brought back straight into this page here. So that's a demonstration of the CRID system. It's very easy to create an account and to create one or more CRID identifiers. If you have any problems at any time, you can just send an email to gerry@thecrid.org or info@thecrid.org, or even contact Monica directly. So if you have any questions, I'll be happy to try to answer them.
Gerry, thank you so much for explaining how CRID works. Actually, it's really good to have this tutorial because we just got off the line with a principal investigator regarding a clinical trial. We also are in partnership with Combined Brain to collect biosamples. And CRID is an amazing tool that you created, and we are so grateful for that because it really makes things efficient and organized. So I actually have a question here from Luke, and he's wondering where the data is stored.
Yeah, well, the data is stored in an Amazon AWS cloud server based in Dublin in Ireland, which is actually where I'm based. The reason why it's based in Europe is so that it has to adhere to the Europe's very strong and robust data privacy standards called GDPR. And that is why we've hosted the data in Ireland. CRID is a global solution, so it's not an Irish or a US solution. It's available all over the world, and I think having the data based in Europe satisfies a lot of privacy and security concerns.
You actually just answered or semi-answered one of the next questions, which is on data and privacy and security and whether you sell the data.
No, we don't. I provide CRID as a free service. So, I recognized, many years ago that there's a problem here in the research industry where, with all these data silos. And I just wanted to solve that problem. So CRID is not a commercial solution. It doesn't sell the data to anyone. It just allows patients and parents to create their own identifier for free to do whatever they want with it.
And you touched on this a little bit earlier about inputting a second email address, but what happens if that second email address is no longer working? How can we restore our account?
Yeah, you can actually log in with either email addresses. So even if the email address wasn't valid, you can still log in with that email address. If you forget your password, there's a link on the login page to say click forgot password, and you can put in either of your email addresses and it will send you a link to reset your password.
That's great. And Gerry, I just wanted to really thank you for jumping on a call with us today because CRID is such an amazing tool, and you really found a gap in our system, and you provided a tool that is so efficient and really extraordinary when you look at it broadly. So thank you so much for joining us and providing that tool to our community.
Thank you very much, Monica, for the opportunity.
Thanks, Gerry. Bye.
Bye-bye.